Thank you, Kimberly, for sharing your beautiful story of courage and hope with all of us. We really appreciate you. Thank you, Dr. Chauhan, Dr. Clark, Ganji, and Anaya for enlightening us. Not only is it difficult to receive the diagnosis of neuroendocrine cancer and then also learn to speak NET, it's especially challenging to try to make decisions, especially about treatments. And speaking from my own personal experience when my husband was diagnosed with pancreatic NET 8.5 years ago, we really faced only one big decision, which was to have surgery or not have surgery. There weren't as many options back then as there are now. And as Dr. Aman Chauhan mentioned in his presentation, there are now many more options, which is helpful, but it can also feel overwhelming and confusing. So I'm wondering, what would you say to someone who is trying to navigate and make sense of all these options? Mary, let's start with you.
So I would say this is probably one of the most challenging aspects of NET diagnosis specifically. Having recently been at a treatment crossroads, I experienced this one personally. And my best advice is to really spend some time talking to your NET professionals, including getting second opinions, and also the supportive people in your life to weigh in, those that really know you and can weigh in on what's important to you. So I'm lucky enough to have Dr. Hendifar as my oncologist. And as I recently made this decision to make a change in my medication, he knows how important swimming is to me. It's been a part of my life for many, many years. And we discussed all the side effects of the medication and determined it was still a really good option for me. But knowing that he is invested in what's important to me makes me feel like I'm in the right place. And I think that's incredibly important as you navigate this process. It's really not a one size fits all. So having a team you trust is so incredibly important.
Wow, what powerful and beautiful words. Dr. Hendifar, what about you?
As Mary said, I mean, not everyone is an elite swimmer like her, but everyone does have unique characteristics, desires, or goals that you have to consider. So it's really important to understand that there's just not one right option, and you have to kind of talk and discuss to find the right option for you. And that's the most important thing. And anyone who doesn't feel comfortable with the decision being made is not going to be successful. So always important that you're comfortable and you agree with the approach that's being taken for your care.
Yeah, we want to have some degree of peace with that decision. Yeah. Dr. Lee, what do you think?
So I would tell someone that, certainly neuroendocrine tumors are really different from any other cancer. It's not at all like any other cancer that we know. So this is one of the instances where you'll probably ever hear a medical oncologist who's going to say that, if I give my surgeons a lot of credit in terms of they can go and aggressively, potentially debulk a disease in a patient where the disease has spread outside of the localized area. And that just shows you how different the management of neuroendocrine tumors are. And I think, here it's really to, trust your gut again, build that trust with your providers and lean on that individualized approach.
Wow. Thank you again for sharing such powerful words. So in this next section, we're going to talk again about more treatments, and we're really excited to introduce our next set of speakers. Dr. Lee, take it away.
It's my honor to introduce Dr. Osman Ahmed, who's an interventional radiologist from the University of Chicago, and he's going to be discussing with us the latest in liver-directed therapy, which is so crucial to our multidisciplinary team approach for patients with neuroendocrine tumors, especially those that have significant disease within the liver. I would also like to introduce Dr. Nadeem Malik, who's a radiologist as well as nuclear medicine physician from Oregon Health and Sciences Universities. And she's going to be discussing with us the latest in NET imaging and making sense of all the different imaging modalities that we use for patients with neuroendocrine tumors.
I'm very pleased to introduce Dr. Karina Marie Aparici. She's a radiologist and nuclear medicine physician from Stanford University. Her talk will be the latest in peptide receptor radiotherapy.